Hey everyone, this is Scott from Freedom. For PT month, I just wanted to show you one of my favorite muscles to dry needle, and that is the infraspinatus muscle, which is one of your 4 rotator cuff muscles. This is a right shoulder. Here's your collarbone, your arm, and your shoulder blade. The infraspinatus sits in the back, kind of right in this position like this, and often is loaded with trigger points. The job of our rotator cuff basically is to help pull the ball down. So as we raise our arm up, if this is the ball, this is the socket, as we raise our arm up over our head, the ball is pulled down. If the rotator cuff would be weak, or if it's loaded with trigger points, or the joint is tight, the ball would be more apt to ride up. And when it does that, it can pinch on your tendons or your bursa sac and lead ultimately to tendonitis or possibly a rotator cuff tear. So the muscle that I find very effective in treating for that is the infraspinatus muscle, which is in the back here in the shoulder blade. And again, it's just loaded with trigger points often. So Trent here has been properly prepped. I'm just going to show you how we needle the infraspinatus muscle. So we want to kind of find the borders here. And then usually there's a couple of tight bands in here like that right there, correct? And then do this. So we go in. There we go. And that's what we do. Often this muscle will refer to the front of your shoulder or to the side of your shoulder. Very rarely do people complain of pain when I see them. They don't really complain of pain in the back of their shoulder blade. It's not until I start pressing around it that they realize how tender it is. And we treat this, and we're usually able to have some pretty good improvement in a short time for them.